You're getting the wrong information about back pain. We fix it every day here at the clinic, and I can teach it to you in this short video, what you should be doing and what you should avoid. Let's get into it. The first thing that we want to talk about is low back pain primarily comes from a hypermobility. So we move too much in one or two segments. So looking at this spine right here, we have our lower discs, lower vertebra. That's our L4 and our L5, L5 and S1. That's where a lot of our clients are coming in. They have problems in those areas. We move too much in those segments. That causes inflammation, and then that's what causes your pain. So that inflammation, when it sits down there for too long, inflammation will eat up bad tissue, but if it stays there too long, it also eats up good tissue. And that's where we get osteoarthritis, degenerative disc disease. We get these compressions and that irritation, and that's what ends up causing us these long-term problems and recurrent low back pain. That's what we're gonna dive into in this video, and make sure that you understand what we're doing and how we're fixing these problems with our clients. When somebody has a stiff hips, they're gonna move through the path of least resistance. So when we're looking at the back right here, it takes us to number 2, is that stability and mobility. So when our neck is exposed, we just have muscles around it. At our thoracic spine right here, we have our rib cage, we have joint capsules, we have 9 muscles overlapping, we have the shoulder blades. There's a lot of stuff going on right here. So this is gonna get stiff on us. And then right here at the lumbar spine, we're exposed again. We just have muscles around it. And then at our pelvis, we have a lot of stuff going on. So what we need to look at is, where do I primarily need stability and where do I primarily need mobility? So at the neck, our body's gonna take the path of least resistance no matter what. If we create what that pathway is, then we have control. If we allow our repeated movements and our prolonged postures, the sleeping positions, sitting positions, if we let those things that we're getting in daily dictate what our path of least resistance is, and we don't do something about it, that's where we start having these chronic problems. So it's very easy to move through the neck because we don't have the rib cage around it. It's very easy to move through the low back because we don't have a ton of muscles and a ton of bones around it. So we need stability, we need mobility, we need stability, and we need mobility. We're very focused on the back and getting rid of back pain in this video. And it's not that you've been lied to, but people just don't understand it as well. And they don't have 14 years experience in the clinic working with people and asking for feedback. Are you getting better? Are you not? And making sure that they're holding themselves and their team accountable to getting results for their clients. Number 3, the main cause of low back pain that we see all the time is lower cross syndrome. So when we're looking at the spine right here, we're looking at a cross pattern. So crossing this way and crossing this way. So if I'm crossing here, my abdomen would be right here. So the same thing you can look at on this model. I'm crossing here, abs to butt, abs to glutes, and then low back to hip flexors. So here's our biggest hip flexor in the body. It's called the psoas major. And then our back extensors would be right here. So if we're really tight in our hip flexors and really tight in our back extensors, that makes us tight right here and tight on the front side. That creates that pattern, and we start to go into extension in our lower back. So right here, we're closing down the space for the nerves. What we have to do is we have to loosen up those muscles so that we can utilize our glutes better, so we get more strength, more hip extension in our abdomen. But it's really 80% in the glutes and 20% at the abdomen. The majority of times people are gonna tell you that you need to have stronger abs and you won't have back pain, but you constantly struggle with it. We hear it all the time, and I've heard it from so many clients coming in that they keep giving me ab exercise, but my back still hurts. And that happened to me personally as well. I dealt with a back injury when I was 19, and a guy told me, if you can do a plank for a full minute, then you won't have back pain. I got up to 3 minutes and I still had back pain. So it just wasn't true, and I had to learn more, and I had to work with a more skilled clinician. So that lower cross syndrome, that's what we're looking to change. And we'll do that with our exercises and with our rollouts. And we'll make sure that you understand exactly what to do so that you can fix this problem. Number 4 is movement patterns. Do we move too much through the low back? Yes, we move too much through the low back. So that lower cross syndrome that we were talking about, that's that I'm in this position a lot of times, or that I'm not able, those muscles are tight, we can't see it, but the muscles are tight, they're pulling me into a bad position. A lot of our clients, they're swayed like this, they're hanging on their ligaments instead of using the muscles. So our movement patterns, we've got to retrain our body to move through the correct patterns, and that's keeping our Superman or Superwoman emblem stacked over our belt buckle as much as possible. So I'm moving through the hip, and I'm limiting the motion that's coming through my lower back. So I'm walking this way, and we'll move Harry out of the way, and we rotate through the hips, rotate through the hips, and this is staying stacked right here. So that movement pattern consistently is going to help you, but also learning how to hinge through our hips. So when I'm grabbing a chair, a lot of times we'll do this. I'll go to grab the chair and I'm tilted forward. Now I'm using my lower back to do the work, and it's death of 1,000 cuts. We're just beating up on that lower back. We're getting that inflammation. That's what's causing us problems. We've got to use our glutes. So I come here, I get it close to my body, and then I shift my hips back. My back is in a neutral position, and I can lift this up using my hips. So that's the movement pattern that we're looking for. We've got to reinforce that consistently if we're going to have long-term success. Number 5, what do we need to loosen and what do we need to tighten? We've got to loosen the hip flexors. We have them right here in our lumbar spine attaching. This is that psoas major muscle. And we've got to loosen up the hip flexors in our quad right here. This is also a hip flexor and a knee extender, but it's a hip flexor. And then our lower back muscles. But our brain tells us to stretch the lower back. We're not looking to stretch the lower back. It's just going to cause more movement, and that's going to cause more irritation. We need to limit the stretching when you're inflamed and you're having back pain. Stretching it is one of the worst things that we can do. And you know that because the pain doesn't go away. It's like it feels good for a minute or two, and then 5 minutes later, it hurts worse than before you did the stretch. So by activating our abdomen, so we loosen up our low back muscles because we have something in the body called reciprocal inhibition. If I flex my bicep as hard as I can, my tricep has to be loose. When I get my abdomen to activate better, it will loosen up those back muscles. And so we're gonna utilize muscles and get them activated to allow other muscles not to be doing something that they shouldn't be doing. They're overactive, we're using them too much, and that's what's causing us problems. Also, activation of the glutes, getting those glute muscles fired up. That's gonna allow us to loosen up the hip flexors. We are gonna do some stretching of the hip flexors, but primarily, and I'd say 80-20 rule again, 80%, let's get those glutes fired up so that the hip flexors can relax a little bit more. Make sure you hit the subscribe button and the bell icon so you get notified when we put out new videos. Also comment and leave us questions. Let us know what information you need so that we can tailor this channel so that you're getting the best results in the fastest amount of time. Now, number 1 with our exercises is called the glute rollout. We're going to call it an exercise. What we're really doing is loosening up muscle tissue so that we can take away a lot of the pain and the tension, but also activate the muscles. So right here, this is where our glute is. Our glute overlaps. We have our glute max, our gluteus medius, we have the piriformis underneath it, and then we have the gluteus minimus. We have 4 muscles right in this area, this little circle where muscles overlap, and where muscles overlap, they tend to get stuck together. And so we're gonna teach you how to loosen this up on yourself from the comfort of your own home and make sure that you're making progress. So we're gonna put this lacrosse ball right here, and we're just gonna gently grind it in. But I don't want you to move your lower back when you're doing it. Just a little wiggle right there. So I'm gonna grab this lacrosse ball. I'm facing out, so I'm perpendicular with the wall. I'm gonna go right here where my belt loop is. So here's my hip bone right here. Here's my pelvis bone. I'm gonna cut it in the middle, and for a guy, it's right at our belt loop, right? And so I'm coming right here, and I'm gonna turn 30 degrees. So it's gonna go right there, exactly where we are right there. So it's gonna start here, and then I'm gonna rotate the hip where it comes back, just like that. So I set up right here, I come against the wall, and then now I'm gonna rotate my body about 30 degrees, and I unweight this leg. So I don't have to lift it up in the air, but I don't want any weight on the leg that I'm putting pressure on. And so I'm loosening that up. I also don't want to wiggle through my back. That's going to cause that extra movement that's going to cause more irritation. We want to limit the motion coming through our back. I'm digging in here. This is going to be tender, and I want it to be tender. If it's tender, we know we're in the right spot. As long as you're not all the way back here on that sciatic nerve. I don't want you putting pressure on the sciatic nerve. It's going to irritate it. Let's get in the right spot and we'll dig out that muscle tissue. So I start from the side right here, and then I rotate about 30 degrees. I put pressure into it, and then now I'm just sitting there. I'm gonna find 2 different spots for 30 seconds, so a total of a minute, and I'm gonna do both sides. So I'm loosening that up. If I'm moving, I'm just gliding, right? I'm gliding on this right ankle. So I'm gliding here, not putting weight through my left leg, and I can glide, I can move into it, and you don't have to. You can just sit in the spot and loosen it up. You can move this leg if you'd like to, right? But I'm not wiggling through my low back. As long as you're doing that, then you're doing good. So I'm gonna find one spot, sit in there for about 30 seconds. I find a second spot, just move it just a little bit right there. That one's tender on me. And so I'm digging this out. And this is our starting point. So make sure that you subscribe and let us know if you want the progression, because all of our clients, they come in, they have their starting plan, and then we have progressions at 2 to 3 weeks. And then at 4 to 6 weeks, they're doing really good. And we've got to take them to the higher level of exercises. And that's where I see a big problem with the physical therapy field, is that the exercises that you get on day 1 are the same exercises you're doing on session number 8. That doesn't make any sense. You should be improving, your symptoms should be improving, you should be getting stronger, and we should be reinforcing really good movement patterns. Make sure that you're getting long-term success. So the glute rollout, 1 minute on each side. I'm going to set up on the other side right here, drop my weight down, unweight this right leg, find the tender spot, and then not wiggle through my back. I'm just digging in right there. 30 seconds in one spot, find another one, gotta be tender. 30 seconds in the other. It's gonna be tender in the spots, especially if you're having low back pain, it's gonna be tender there. Let's get into number 2. Number 2 is a hip hinge squat. If you look at a book called Outlive, Peter Attia, he's a physician, and chapters 12, 13, is like, he's a brilliant physician, and he's saying that hip hinges are the most important thing, one of the top 5 most important things that we learn as we age. And I happen to agree with him. We have got to move through our hips. When we do that, we keep our Superman emblem and our belt buckle stacked. But also when I'm bending over, I should be loading through my hamstrings and my glutes. So here's my hamstrings, this is my glute. And so I'm gonna hinge right here through the hips, and I'm keeping my spine in a neutral position while I do it. And that offloads the spine and it puts pressure down into here. The way that you do it is that I'm gonna measure my foot length. So it's gonna be for you at your house, you're gonna measure your foot length away from the wall, just like this. Slide this foot over, slide this one here. I'm lining them up. Like your lower leg is like a stake being driven into the ground. It goes straight up. I'm gonna keep my face in line with my chest, and I'm pushing back with my butt. This hip hinge is a backward and a forward movement with the hips. The hips are leading it. What you should be feeling is a pull through your hamstrings, just a little pull. We're getting that glide of that sciatic nerve. We're activating the hamstring muscle. After about 2 to 3 weeks of consistently doing this, what we see here at the clinic is that clients start feeling it in their glutes a whole lot more. Right now, your glutes are asleep. They're not doing their job. We need to wake them up. But we're gonna utilize the hamstrings, well, because they're typically more active. We'll use them right now, but we're priming those glutes. We're loosening it up and we're firing them up. And when we do this exercise, it's just gonna take a little bit of time. So give yourself some grace, be consistent with this, and it's gonna work. We're gonna fix this back problem. So my face stays in line with my chest. I push back with my butt bones touch the wall, and then I push forward with my butt, keeping my back in a neutral position the entire time. So after I've done the glute rollout, I'm doing this. It's very mechanical. I've had clients say that it's like sitting on a toilet. I say maybe, if that makes sense to you, then absolutely. But I'm pushing backward. I'm pushing forward with my hips and maintaining this position. Sometimes I teach clients, I say, act like you're a robot, and I make them make noises. Say, Now, another trick that you can do is put pressure on your thighs right here, and I push back and I slide my hands down to my knee and I come back up. One of the biggest problems that I see is when somebody comes back up, their eyes are locked on the wall. And when my eyes are locked on the wall, I extend through my neck and it makes me extend through my low back, and I lead through my head and my lower back instead of leading through my hips. So I want you to focus on that. Trick number 4 with this one is to put pressure on your butt bones and push back into them right here. So I'm pushing back into them and I'm pushing back up. So when you do this, I want you to do 2 sets of 15. You're just consistently doing a correct movement pattern. We're retraining the brain and the body to move cohesively, moving through those hips. Number 3, we're doing a hip flexor stretch in standing. So our hip flexors is this psoas major coming down. It's right in here. It's a deep muscle. This called the TFL right here. And this is called the rectus femoris. Those are our 4 major hip flexors. So what I'm gonna do is get on this chair. What I want to do is just come down into this position and keep my back in a neutral position. So what I don't want to do is chase this stretch like this. That's what I see a lot of times, is that people will chase that stretch because they feel it more right here, but now we're sacrificing the low back. You can see my lower back is way into extension. I'm closing down that space for the nerves going into extension. I don't want to do that. I have the chair right here so I can keep pressure on it, and I push forward. I squeeze my back glute right here. So that'll get me that reciprocal inhibition where I'm firing up the glute to loosen up the hip flexors. If you can't feel it there, just get a little bit further from the chair. So now I'm pushing down. Now I feel a good stretch right there. Now I can push my hips forward and squeeze that back glute. And I'm holding that for 30 seconds. And then I'm gonna just switch sides, where I'm coming forward, squeezing that back glute, loosening that up. So I feel this stretch all through here, squeezing, and I keep my back in a neutral position. My head is in line with my chest, maintaining it. Do not do this. That's just gonna cause you more pain. So I'm gonna set up right here. I'm doing it twice. I'm gonna do that squeeze in the back glute, driving down, my pelvis is dropping down. I don't want to put a lot of pressure on my knee by pushing it way forward like this. That's going to be counterproductive for me. I don't want to be here. I'm going to get that foot forward and make sure that I'm firing the correct muscles. So squeezing that back glute, getting in the stretch, dropping the pelvis down, keeping the back end neutral, and I get a good stretch right there for 30 seconds. And then I'm just switching sides. So I do it twice on each side. Make sure that you look at the videos of the exercises. We have a lot of videos on our channel of what exercise we do, progressions, regressions. If you can't find what you're looking for, make sure that you leave us a comment, let us know what you're looking for, where you're having your problems, and we will create content to make sure that you're getting the results that you're looking for. We'll see you in the next video.